knock, knock. Hi, I'm Amanda and I'll be your nurse today. Can I get your name and date of birth, please?
Trista Hahn, 36-2000.
Okay, and today we're going to be assessing your breast because you found a lump on it at home, so we're going to be going over that and assessing it. So first thing I'm going to do is take your vitals. So I'm going to put the cuff on and do your blood pressure here. Okay, that's 116/64. I'm going to take your heart rate, which is 62, and your resting heart rate is 13. I'm putting this in your mouth, if that's okay, to take your temperature. Perfect, 98.4. And then your O2, which is 95. So that's all good. And then if you don't mind, I'm gonna feel around your breast to look for any like lumps or abnormalities. Okay, perfect. So I'm gonna start here and I'm gonna go in a clockwise circle. Okay, that one is good. Now I'm going to move to the other side. And then move out. Okay, so when I was feeling the right breast, I did come across a lump. Was that painful for you?
Yes, very.
Okay, so since that was that, I'm gonna talk to the doctor and potentially get a mammogram done, which will help evaluate for any unusual changes in the breast. So the next day or whatever, there was a tumor found on the mammogram. So I'm following the mammogram. Other tests were then completed, such as a breast biopsy and a sentinel node biopsy. The results showed an early stage invasive breast cancer. So the patient is now back into the hospital or the clinic, and I'm explaining to them the best treatment option for bilateral radical mastectomies, one for the tumor and one for the prophylaxis. Before the surgery, I will then inform the patient to take their pain medications, exercise the arm after the surgery. You want to rest your body and take fluids in. You want to recognize the signs and symptoms of infection, which will be red, swollenness, any abnormality in the discharges, if there's any of that. And then also take sponge baths until the doctor has removed the drains and sutures. And then after the surgery, she took some more stuff, and the TNM staging system result is negative, and she was given a reoccurrence score of 35, which 35 is a high. I'll explain to the patient that 35 is a high risk score because breast cancer has a high rate of returning. So that's upsetting, but the bone marrow biopsy was normal, and then 2 months post-op, she begins chemo. So for the care plan for Trista Hahn, I will explain to remain free of infection, which is important, and then how to help check for that and keep infection rates down, and then experience minimum pain. So she has some medication she's taking to help minimize her pain, but if her pain becomes spiked or unbearable, that she should come back in and we can help find a new solution for that. And then for the S-bar, I wrote Trista Hahn is a 40-year-old patient who has early stage invasive breast cancer. She has recently undergone chemo and is now at home resting.